Now the muscles I'm talking about specifically are longus collis, longus capitis. They sit right here at the front of your neck. What we're looking for is that the big muscles here, sternocleidomastoid, scalenes, etc., do not overwork. So the test that we'll put Tegan through in a moment is to make sure that these muscles are working and these big overlying muscles are not trying to do the job instead. And we do that through this deep neck flexor test using the stabilizer, which is this machine here. The advantage of it is that it gives us a way to actually get an outcome measure to justify what we're doing. Now we pump the dial up to this marker here, 20, the bottom of the red zone. And that's where we start the test. And then the test itself is going up by 2 millimeters of mercury, which is each of these different colors. Now when our client does the test, if they get up to the top here, above 28 millimeters of mercury or into this gray zone here, it tells us that there's no dysfunction in the deep neck flexors, and the cause of their neck pain or the dysfunction or the inability to do the Pilates movement is not related to these deep neck flexor muscles. So the first thing we do is we fold it in thirds like this, then we clip each side here and here, and this is basically an air-filled chamber, 3 air-filled chambers that need to be filled with the air evenly. And then we slide the pad directly under the client's neck, and we do that deliberately. We don't want the client to be able to lift their head, because remember, they might be in pain or dysfunction. I lock the stabilizer off through the button on the side here. We pump the dial up to 20 millimeters of mercury. And remember I said it was a 3-chambered pad, so now I go in and just move the air around a little bit to make sure that the air is even between those 3 chambers. And what you'll normally see is that the pressure drops down a little bit. Okay, so I just bring that back up to 20, which is the start point for my actual assessment. Now the assessment is actually quite straightforward. All I'm doing is looking at how Tegan can nod her chin and what happens to the muscles around her neck. I'm going to put my hands on the side of the neck so I can feel these big sternocleidomastoid muscles. I ask my client to get into the position where we align the jaw. Now the reason that it's so important to get this pad right up under the neck, and the reason it's so important to have this pad right up on the occiput, is that if the pad is further down, we're actually testing the mid-cervical spine. We must be testing the upper C spine here, OC1 down to C3. That's where our deep neck flexor muscles have their effect. So the first thing I'm going to do is make sure that I'm in the right setup. When I ask Tegan to nod her chin, I should get a nice little movement on this dial. Okay? With my hand, I'm going to feel over sternocleidomastoid here to tell me whether this big muscle is working, because the whole concept here is that these big muscles should not work. I need to get underneath. And when I'm talking about the deep neck flexors, what I mean is longus colli, longus capitis. Okay? They sit right on the facet joints at the front of your neck. So they're the muscles that can help control a lot of what we see with head and neck pain. All right, Tegs, all I want you to do in a moment is you're going to nod your chin. Remember I said that this is all linked through to the TMJ as well. So we set the jaw prior to doing the movement. It's a fairly common cue that a lot of you probably will have heard. So Tegan, lips together, teeth apart, tongue on the roof of your mouth. The lips together, teeth apart, aligns the TMJ here into neutral, and I feel to make sure that that's in a nice neutral position. Then we ask Tegan to put the tongue on the roof of her mouth, and that just lifts the hyoid bone to make sure I can get into those deep neck flexor muscles. All right, so I'm going to feel sternocleido here now, and just ask Tegan very gently to just nod your chin down towards your chest. Great, and I can see that I've had a nice response on the dial there. So I'm happy with my test, I'm ready to go. But that one nod, that big movement, doesn't tell me anything about the individual stability of the neck. So the test is simply a way to see at what stage of condition or what condition these deep neck flexors are. Now on this dial here, there's different zones, 22, 24, 26, etc. We're going to test each of these zones. Each zone is 2 millimeters of mercury, and that lets me know sort of what grade the control of these muscles are at, if you like. If Tegan can nod her chin and not use any of these big overlying muscles, and get the needle right up towards the top here, this grey zone, it tells me that there's no issue with the deep neck flexors. Okay, which tells me two things. From a Pilates point, it tells me Tegan's absolutely fine to go on to her prone line exercises, things like swan dive, breaststroke, swimming, all of those sort of prone line exercises. If Tegan can't do that, it tells me that I need to look further into this to see just what stage she's at prior to going on to the exercises themselves. Now, when you're dealing with neck pain, you're generally dealing with three things that can cause the pain. Is it the articular system, the neural system, or the motor control system? Here, we're just testing the motor control system. Now, in an assessment situation, this is exactly what I would do. I assess the client, I choose one of those systems to treat that, and then reassess. In relation to the motor control system, this is exactly what I would do with my clients day in, day out. Okay? From a Pilates point of view, I'm simply trying to see what stage these deep neck flexors are in relation to whether I'm happy to progress them onto their prone line exercises. So the first thing that I'm going to do is check whether Tegan can just get to that first little red line on this dial. Now, in order to do that, I need to show the dial to my client. So I'm now going to place the dial above Tegan's face. So, Tegan, I'm going to show you this little dial there. Can you see that? Okay. Now I'm going to place my hand right here over this sternocleido so I can feel. And Tegs, all I want you to do, I'm just going to bend down here for a minute so I can see it as well. But Tegan, all I want you to do, let's just get that a touch. Okay, lips together, teeth apart, tongue on the roof of your mouth. Looking at the dial there for me. Okay, and then just a very nice gentle chin nod just down to the top. There you go. Lovely. Hold that now and relax. Okay, so Tegan can nod her chin and the pressure goes right to the top of the red zone there. So it's basically, if I'm doing this test, a tick in the box. Can she get to 22? Yes or no? Yes, she can. So now I need to check the endurance of these muscles. So we're going to go back to that same test, 22, the top of the red zone, and see if Tegan can hold that for 10 seconds. Okay? Same thing, lips together, teeth apart, tongue on the roof of the mouth. Gently nod the chin down, hold, and now we hold it for 10 seconds. And we see if Tegan can hold that needle nice and still and breathe normally. So now I'm just checking the endurance. Can Tegan actually maintain that pressure? And she's doing that fine. And relax. Good. So first stage of the test, Tegan's fine. Okay, can she get to 22 millimeters of mercury? Yes. Can she hold it for 10 seconds? Yes. So the muscles can work and they have the relevant endurance. So then I just go up by 2 millimeters of mercury each time, which is the different colored zones on my dial. Next step, we go to 24. So Tegan, you're doing brilliantly. All I need you to do now is we're going to go to the top of this green zone here. Okay, lips together, teeth apart, tongue on the roof of the mouth. My hand's on this sternocleido muscle. And then again, just gently nod down top of the green zone. There we go. Hold. And now relax. Okay, so same process. Can she get there? Yes or no? Yes, we can. So then we test from the endurance point of view. And again, just 1 second. There we go. And gentle nod down. Great. Hold it there now. Don't let it go. Keep breathing. Good. Keep looking at that. So you're looking at your test there. I'm still happy with what's happening around the neck. And then let go. And again, on the release, it should be a nice smooth release. And that's basically your test. Now, then we would go up to 26 and then up to 28. Now, as I said, if we get to 28, it shows me that the deep neck flexor muscles are absolutely fine. They're not part of whatever issue might be going around the neck. So I need to look back at, is it a joint problem or is there a nerve issue going on here? What we need to see is what you've just seen here, that your client can get up to 24 millimeters of mercury on this dial and hold that for 10 seconds. Now, the reason when we're dealing with people with neck pain that's so important is when they have sort of pain and instability in relation to the C-spine, they very often tell us that as they get tired and fatigued, their head feels very heavy. It's hard to hold their head up towards the end of the day. So to summarise that up for you, position your client so that the cushion is right at the base of the occiput. We always make sure that the knees are bent up just to make sure there's no dural issue around the neck. We place the pad right under the neck and right up against the occiput, hands over the sternocleido muscle. The cue for the neck TMJ connection is lips together, teeth gently apart, tongue on the roof of the mouth. And then we go through the test with that gentle chin nod. Okay, now once again, making sure that you're making sure that there's no overactivity of the big neck muscle.